All right. So thank you all for joining us tonight on our presentation on injury prevention and management. This is the first in our Perform 24 webinar series for 2022 with the USATF-New England. The goal of our presentation is to help you to prevent injuries, know your body, and then if an injury does occur, build back to your very best. We're going to start off with some introductions. Go over what discomfort, pain is versus an injury, how to prevent injuries, reacting if something hurts, injuries by type, injuries by body part, building back in the event of an injury. I'll leave some time for questions, and then a little bit of USATF New England news. So we are very honored to be joined by the speakers that we are. We have Dr. Gary Geisler, Doctor of Physical Therapy. He's been working with Harvard Sports Medicine and specifically track and field for over 25 years, worked with US Olympic and World Championship track and field teams. And I think he's an invaluable resource on how to prevent and manage injuries, and specifically from a track and field perspective. We're also very lucky to be joined by Joe Tranchita, USATF Level 2 coach, Maggie Fox, USATF Level 1 coach, and our USATF New England VP. And then I'll be helping to moderate. My name is Amanda Pasco, USATF Level 2 coach, USATF New England VP, and then directing this Perform 24 program. And then we're also joined by our USATF New England President, Dave Tesler. If at any point in the presentation you have questions or comments, feel free to put them in the chat box, and we will do the best that we can to get to those at the end of the presentation. So Gary, feel free to take it away.
Great. Thank you so much, Amanda. Just a little bit more about myself. I'm currently serving as a sports performance therapist with Harvard University Track and Field. Started that right before the pandemic, and then of course we had the pandemic, and but we're back, and as I said earlier, we're competing and excited to be part of the team again. So for discomfort, in trying to identify what's an injury, you know, the more skilled, or not more skilled, but the more you've been in athletics and track and field, you kind of have a sense of like, oh, there's a hard training session, my legs are sore the next day. Most of the time, and the coaches can comment on this, but discomfort and that kind of discomfort is usually it's bilateral. And when things are bilateral, it's a good sign, and it's from training or maybe some new task. Pain is, I'd say we'll try to keep it brief for this discussion. Pain is definitely multi-leveled and beyond the scope of a whole bullet point. But I think we know when something really hurts and it's painful and it compromises your gait or compromises your capacity to complete the task. And then that should be brought to someone's attention, whether it's your coach, an athletic trainer, physical therapist, or if you're a younger athlete, your parent, and they should have, seek some help and get a diagnosis. And that's where we go to injury. And then the injury is really when you're unable to take part in your primary activity, secondary to pain and dysfunction. You really can't complete the task. Now you may be able to do some cross training with an injury safely, if that's been discussed and prescribed by maybe the coach or, like I said, a medical professional. So unless anybody wants to jump in here, I think that hopefully covers it for you guys. But like I said, discomfort usually is something from training and goes away. There are maybe some little things that, might be a little uncomfortable at the beginning of the run. It goes away after the run. That's a good sign too. All right, an ounce of, right. Switch my slide here. An ounce of prevention is worth a pound of cure. We've heard that for a long time. But again, a good warm up, and I know coaches are on board with this. It's so essential to kind of kickstart your neural system, but also warms up the tissue temperature. And you're taking those muscles and tendons through a certain range of motion, and with a greater pace of activity, you increase their tissue temperature and their compliance. I like to put in moderation. I always think that consistency, moderation, and then diversity within things keeps you from getting injured. But definitely moderation, particularly at the beginning of the season, and building up and letting those tissues kind of get a resilience and build up that tissue tolerance. And then, consistency in training. Right now, we're coming off a very successful cross-country season. And what we're seeing is, people go into active rest, but there also is, there's some, when you're not going as hard and as fast as you were, tissues tend to kind of shrink back a little bit. It's called creep. And now you're a little bit more stiff. So coming back, you need to kind of bring that back, get that range of motion back. So the gradual introduction to new activities, when those are outside of your tissue bubble, so to speak, you need to allow for new adaptation to occur. I like to make like an example of, like, we can be at the top of Mount Everest, and you can have a little maybe bite to eat and then get back down. But if a helicopter dropped us off there immediately, we would have a very difficult time. So your body really loves adaptation and will comply. So specific also to gradual introduction to speed, I would put speed and surface in there, because like I said, we're going from cross country to indoor, and we have a banked track. It doesn't matter if it's banked or flat. You're going to have to adapt to that surface, and you're going to be leaning in. You're going to have that rotation. You're going to be going around in that 200 meters over and over again. You see a little bit of IT band problems there, maybe Achilles, getting used to the spikes and just being in spikes the whole time. Post-activity mobility is a good idea. Tissues start to cool down just like pizza cheese. And if you pick up a piece of pizza a half hour after you put it on the counter and you haven't eaten it, it's pretty stiff. I mean, your tissue is going to be more mobile than that. But again, if you do a little bit of post-activity mobility, it kind of gives you a little bit more range of motion the next day when you go to work out. Sleep is, I think we've got some things on here about sleep, but sleep is huge. We have all these devices like Whoop and stuff that track that. It's very important. I must say, though, that Dan Lieberman, an anthropologist over at Harvard, he has a new book out, and he did say that, the people that he studied, the groups of people he studied, you can get by on 5 to 6 hours of sleep. But I think when you want to build it in there for yourself, it's good to get the 8 hours if you can. So technology, dropping that in, like we said, with the Whoop device and some of these other Fitbits and even your phone or whatever, it gives you a lot of feedback these days, and it's worth investigating and see if that's something that would be good for you. I think also on technology, I'd like to just acknowledge like what we're doing here now, the ability for us to communicate with each other through these devices, to also follow, if you can, the right people on Instagram or Twitter. I'd just throw out the Montana Running Lab with Rich Willie is a great follow. Really good biomechanist and superstar out there. So that's just one. And then I put in here adherence to coaching strategies. Some people say, well, I feel great, I'm going to do like a little bit more than coach prescribed. But then when you have the next thing that he's expecting he or she to do well in, and you're like, you don't quite have it because you went off schedule a little bit. So I think there's safety in the coaching, and there's a good strategy to get you better. So I would just say, don't go off on your own without really having good coaching. So if that's kind of a lot on that slide, but I think it's important. Thank you. Is this my slide for nutrition?
Yes, and I'd be happy to support on this one as well.
Yeah, jump in, Amanda, please.
Yeah, so this slide is diving in a little bit deeper on a few of the other lifestyle practices that we talked about on the previous slide. Um, so when it comes to sleep, this is obviously very individual. Um, Research has shown that in order for your body to adapt to training, so training and workouts break down your body ever so slightly in different ways. I think the most obvious example of that is little micro tears in muscles from hard
Yeah,
training. And then over the following kind of 24 to 72 hours, your body repairs those so you're stronger. There's a lot of other ways too that training breaks down your body a little bit, and kind of the bare minimum amount of sleep for your body to be able to repair that damage and help you become a better athlete is around 6 hours. Um, Again, sleep's very individual, but research does suggest that kind of 8 to 9 hours is a golden spot for
right.
kind of your body fixing those little bits of breakdown, so to speak, from training, which helps make you a better athlete, also prevents injuries. Kids could
Yeah.
potentially need even more than this. So nutrition, we're going to talk a lot more about this in a future
Thank
webinar. I think one very helpful strategy to the right of the screen is what we call the athlete's plate, or the plate method, but for athletes. Um, so if you kind of look at this plate, half of it is grains and starch, and that's because it's very high in carbohydrate, the preferred fuel of exercising muscle. So it gives you energy, and also when you have enough carbohydrate, protein, which is about a quarter of the plate, can do its job of building and repairing tissues and other kind of breakdown in the body. You've got vegetables about a quarter of the plate. Your fruit ends up off the plate because you had those extra starches. Fruits and vegetables very helpful for reducing inflammation. And then you have fat sources that may be distributed throughout that meal, like olive oil, for example. So again, this is a very general overview, but each of those food groups has a purpose for athletes. It's important to eat enough because if you are in a calorie deficit, your body will be unable to, it won't have the energy to fix any breakdown from training. So it makes injuries a lot more likely immediately after a workout. Having some protein, because after a workout, your body cells are most receptive to using that protein to build and repair. Carbs with the protein can help that protein go into cells faster. And then also having protein throughout the day. So it can be common in the American diet to have a very carbohydrate focused breakfast, a little bit of protein at lunch, a lot at dinner. Because the body is constantly going through cycles of building and repairing, kind of recycling the proteins in it, it's important that you are hitting protein throughout the day. So again, that's very high level overview,
Excellent.
some key points. And then we have another webinar focused more on that. Another piece, stress management. Again, webinars focusing on that, but I think it's important to plan ahead, kind of keep a clear mind before practice. There is some research suggesting that elevated stress-related hormones have a range of adverse consequences in the body that can actually make injury more likely. And then lastly, we've got technologies. Just the more you can record what you did, how you felt during it, the more you can make sure that you're building forward piece by piece. You're aware of anything that hurts or doesn't feel right. You're taking recovery to allow your body to adapt and get better from that training load.
Yeah. By recording the workouts and how you felt, then it gives you a chance to go back and identify and help the clinician who's trying to help you identify how it came about. You might be able to point to that workout or that something different that you didn't feel was a big deal, but when you go back and think about it, you can maybe identify that or incriminate that workout as like, I think that's where it came from. Because not a lot of the times, but there's a number of times that, we're not quite sure, like, what happened. They didn't turn and sprain their ankle. They didn't have an acute trauma, but there was something, you know, it started here or there and then it built up. So it's good to have that.
So this is our first Coach's Corner section, and this is on preventing injury. So we'll hear from each of our two coaches here.
I just want to piggyback on the nutrition, sleep, recovery between workouts as being really a critical piece to preventing injuries themselves. I deal a lot with younger athletes, pre-high school as well as high school. We need to be aware as coaches and parents of young athletes that they tend to do multiple sports, which in and of itself is a good thing because they're getting a good mix of training modalities. But oftentimes they go from one sport to the next sport to the next sport, sometimes 2 or 3 in the same day or back-to-back days. And the subsequent coaches of each of those sports really doesn't know, they're not connected necessarily. So they don't know what went on the day before and what's going to go on the next day. And so overtraining can become an issue in that respect. My larger concern isn't the overtraining, because hopefully if they're doing different sports, they're getting different modalities and using different muscle groups, but the recovery from one sport event to the next sport event may not be adequate to cover the particular stimulus of each training routine. So I think the coaches and parents, high school athletes, need to be aware of that, particularly with the youth members. Oftentimes injuries are blamed on overtraining, you know, unless there's something traumatic, but oftentimes it's not so much the overtraining, it's under recovering, that they don't give themselves ample time, whether it's 24 hours to 72 hours, depending on the stress of a particular workout. Growth issues with young people also have to be taken into consideration. The young kids, even high school athletes, they grow at different rates, different ability rates. High school athletes are changing almost by the day, and we really need to be in touch with that as high school coaches and even as parents. Bone development is happening, fluctuating throughout a teenager's span from ages 13 to 16, 17. If we give a training modality, which may be appropriate for that age, but at that particular time, the bone is going through growth, then we're hitting that bone at its weakest point, and even mild training can cause a stress reaction or even a stress fracture, even though we're trying to do all the proper things. So we need to be in tune with each athlete's body development as it's going through the teenage years, youth years, but particularly the teenage years. I like to really emphasize, starting even with my youth members, even though they may not get the general concept, moving right into high school, of what training fitness process is really all about. If the workout is the stimulus, as Amanda stated earlier, when you do a workout, you do have micro tears of the muscle, micro fractures of the bone. The body, being an amazing machine, then goes through recovery mode. So you have the stimulus, which then triggers recovery. The body makes the bone a little bit stronger, makes the muscles a little bit stronger. And then from recovery, it triggers into adaptation. But that is a modality. A lot of athletes think if I work harder, I'll get fitter. It's not how hard you work. It's how hard you work in relation to how well your body can then recover after the stimulus workout and then adapt to it. If you go overboard or you don't do enough, then the adaptation is not going to take place. So it's really critical that athletes learn this. Even elite athletes have a difficult time understanding this. And the important piece with that, nutrition, obviously, because if you're not getting all the things that the body needs to do that recovery, it's not going to happen in an optimum fashion. But more importantly than that, the recovery and the adaptation happens when you sleep. It doesn't happen during the day. And this is where the 222 component originally came up with this educational series. I tell my athletes all the time, the 2 hours they spend with me are really probably the least important. The 22 hours that they're away, taking care of their bodies, getting nutrition, sleeping properly, really dictates how well the 2 hours they're with me is going to transpire with time. So we need to educate them. I found a very interesting comment from Ellie Perrier, who many of you know is now a professional athlete, an Olympian. She's the American indoor record holder in the mile and 2 mile. When she turned pro, she made a comment saying that now as a pro, my full-time job is sleep. And we found that to be very, very telling. As her training increased and her mileage increased, she really had come to understand how important sleep was to that recovery mode. So I think it's important that we understand this, the parents understand it, and we try to educate our athletes to understand it. Final point with things to preventing injury, particularly with high school athletes, preseason training. Oftentimes they'll go from one sport to the next sport without doing general conditioning to make that transition to the next sport, as Gary was referring to, whether it's going from a hard surface to soft or soft to hard. They just come right into the season all raring to go, but if they really haven't done proper stretching, proper body weight type conditioning, balance type drills, things that are going to prepare them for the rigors of that particular sport, then they put themselves at greater odds of injury.
Apologize about the little slide glitch there.
No worries. Yeah, so a lot of this I'm repeating, and that's telling that you're hearing 3 different people, 3 different backgrounds telling you the same thing. I mean, it's not new, but sometimes I think it's underestimated how important recovery is, and people hear it and they know it and then yet don't do it. I think when you talk about workouts being a stressor, that's easy for an athlete to understand from any age, but especially when you get to adults who are still competing as open athletes or masters athletes, your life stress, well, a 14-year-old may debate this issue that they have more life stress going on, but the life stressors play an impact on that day stress that you have that then you have to recover from. So I think sometimes I'll be working with an athlete who thinks they're taking a day off and they might not run, but then had a very stressful day running around doing their job. I mean, I've coached doctors before, and I don't think they really recovered that next day if they performed 2 surgeries, you know? So taking into account your whole life picture and what your stressors are on different days impacts how much recovery you're going to need after whatever workout you've done. I think just being aware of that and putting it in your little toolbox and making it part of the big picture is helpful. Slow progression. So both Joe and Gary talked about this, just adding one stimulus at a time. So when we talk about stimuluses, don't increase mileage and intensity and add elevation and start running on a track. And I mean, it's easy, especially we're in January still, and those New Year's resolutions, everyone wants to go out and get super fit and want to do everything. And how many people at the gym are still there by March? I mean, this is something that you should just take into account when you're slowly adding. It's not just slowly building one thing, it's also making sure you're not doing it all at the same time.
Right.
But building one thing at a time and focusing on that for a couple weeks, and then feel free to add the next stimulus as long as you're still not increasing the previous one. Preventative, so strength, mobility, I think they go hand in hand. So I have been doing foot mobility exercises with my athletes and myself for the last 2 years, and I've seen a drastic decrease in injuries. When I say foot mobility, I mean like toe exercises to improve proprioception and strengthening those intrinsic muscles inside your feet. So toe crunches and toe splaying and toe walks and heel walks and walking on the inside of your foot and the outside of your foot and doing ankle circles and all that stuff. Really, I've seen a noticeable difference. And then hip mobility, it's talking about doing fire hydrants and donkey kicks and, you know, hurdle walkovers and all that stuff. That's what the mobility side of it. And then strengthening I like the eccentric calf raises for those Achilles tendons. So eccentric just means not focusing on the raise, but focusing on the lowering down on a step. And hip strength, I mean, when you're looking at a runner, 9 times out of 10, they have weak hips, which cause all the other injuries. It's kind of like a cannonball effect, or domino effect. So I think strengthening those hips and clamshells and band walks, and I mean, you can Google it and put in YouTube, and immediately you'll get a million exercises. But picking some of those things to incorporate into your routine, I think would be really helpful in terms of preventing injuries. And I found lateral drills really great, especially for adult athletes. I think as a high school cross country coach, I love when kids get cut from the soccer team. It is terrible, but I love it because they're the ones who aren't going to get injured. They've been doing lateral exercises since they were toddlers. They can run back and forth in between cones and push over onto the outside edges of their feet, and they've strengthened all those intrinsic muscles that the other kids now have to sit and do all this foot mobility stuff to build it up, because they don't have it naturally when they've just been doing running, which is all linear. So incorporating some lateral drills, again, progression, nothing like crazy. Don't spend all day doing these like zigzag cone drills and then you're going to get hurt. But incorporating things like that a little bit into your routine to strengthen those extra muscles really pays off in the end.
All right. Well, what do you do? What do you do if something doesn't feel right? We talked about this at the very beginning, but does not hurt. I'm so sorry. Are we back? There we go. Sorry. Yeah, it's fair to look it up on the internet, but you know, you want a reliable site. So you maybe want to go to like Mayo Clinic or something like that, where you can be sure that you're going to get good advice. You know, there are a lot of people giving advice on TikTok and all sorts of sites these days. You know, it should be a reputable site, and I think we can, you know, recommend something like a hospital website, a sports medicine website. Again, also you can check with your parent or coach, and they'll give you a good, you know, referral and get a sense of what's going on there. Getting to a doc or a physical therapist, chiropractor, ATC, all very good at taking care of these problems for you. And then, like we said earlier too, check your running log and check your history and see what you were doing at that time. Just to touch on a couple of the things that the coaches have said. One was about, you know, introducing new exercise. I think both said this, but you want to dose it in too. Think of it as, you know, you don't want to overdose. You don't want to do too much. So if you just dose it in or titrate, let it titrate in, that's going to help you out. There was one other thing I wanted to touch on. Oh, what Joe was saying about healing and stuff, you know, little micro injuries that occur. And Amanda said, but you get these little micro changes, and if you allow that healing to occur, the next day there should be enough healing there that now you can go out and stress it again. What sometimes happens with stress response injuries is we don't have enough time for that healing to occur, then we stress it again. So it just starts to get to a little bit of a failure point, and then that's very uncomfortable. Stress response injuries usually are more to the periosteum of the bone, and it's highly sensitive, and so that's, you know, it's going to present itself pretty quickly. All right, next slide. All right, mild pain. Again, check in with somebody. It's something that sometimes you can train through, but identify if it's, you know, if you have the resources available to you and you can see somebody, they can identify what it is, and then you build up a plan of care. You got your treatment session set up and your therapeutic exercise. And sometimes I say we have a working diagnosis at this point. Let's see if it comes, you know, comes to bear that what we think it is, it is. And also you can have trial treatments So you can do things to see if it's effective for what you think it is, and if not, then you change course, or you can again refer out and get a more accurate diagnosis. If you may need imaging, and then again modify your activity or just take a little bit more of a break. Use that rest session. A major pain is like big time stop. I mean, you've got to go and figure it out. You've got to tell somebody right away. Don't really try to train through these things. You're going to end up in a worse position and you're going to be out longer. You know, and again, if it comes on gradually, it can still be a big problem. It can be maybe a sacral stress response injury. It could be a femoral neck. So those are the kind of the worst case things. But sometimes people think, oh, I just tied my shoes too tight and I can't, you know, I've got to, you know, take it easy. And that might be a metatarsal stress response. And, you know, you really, you know, you got to check it out. Stop actively generating pain. So, try, you know, you can try to, again, after a diagnosis, you can go to an alternate training. Like if you have a stress response in your foot, you can go to the pool, something like that. So, you know, again, it's, you got to stop and identify and search out too, to get a good answer of what that's going to be. All right. I got to plug my phone in, so I'm going to step away for a moment.
One of the difficult parts working with younger athletes especially is getting them to discern the difference between types of pain. Is it tightness or is it pain? Getting them to be open about expressing when they're feeling this discomfort. Because a lot of times they just get used to the discomfort, try to train through it. If they know you're going to sit them down, then they won't tell you until it's gone 3 to 4 days, and then it becomes a more chronic injury than an acute injury. So you need to constantly be discussing with athletes, if you're a coach, to be very open when they feel discomfort, to be constantly reading their bodies day to day. For every workout, I make sure to ask them how they are feeling after they do a complete warm-up, so that I can sort of assess whether it is tightness or whether it's a more serious thing that we need to go up into the fitness room and do some cross training or just roll out and stretch. But it can be difficult for athletes to discern that. It's really surprising. They don't know the difference between tightness and an actual injury type pain. How does it actually hurt? Narrowing down the cause and effect is really, really important in getting them to understand that. I like to put it on a scale of 1 to 10. If they have any sort of discomfort, whether it's tightness or pain, with 10 being the worst, that will give you a good read. And then that they can sort of get in touch with and have a better sense of. Obviously, if it's 8, 9, 10, then that's something you need to address a little more seriously. If it's 1 and 2, now you've got to try to get down to the nitty gritty is what's really causing it. Have a series of questions that you can ask them to help them figure out exactly what the discomfort is, what the cause and effect actually was. When did it actually start? Is this new? Is it recent? Have they had it for 2 or 3 weeks? Has it gotten worse? Has it improved? What's their footwear like? Really important issue. A lot of kids are wearing footwear that may not be appropriate to the training, or shoes that just simply may be worn down. What's their foot structure? If they have flat feet, then that's going to bring in a whole host of different things that you want to look at, because they may be overpronating. What other sports are they doing at that time? We alluded to that earlier. If they're doing multiple sports and not getting the proper rest and recovery, or they may have sustained some sort of injury or stress-related type or episode playing the other sport, and then they come to your sport and they don't tell you about it, and you go and give them a hard workout back on what they did the day before, and now you're compounding the thing without actually knowing that you are, because you didn't get down to the nitty-gritty as what's going on from day to day. Even training, if you have distance runners and they're training on the road, it's a very simple thing of asking them, are you training on the same side of the road all the time? Roads tend to pitch ends. Are they running on the sidewalks? Are they running on the curb? If they're running the same way every time, one foot's lower than the other, simple thing like that may bring on different stresses. Then the tough part from a coaching standpoint, and even a parent standpoint, is deciding whether it's a matter of cutting back on the training, total rest, going into cross training, doing pull work. Again, a lot of this comes down to being able to answer those questions that I just discussed as to what the level of pain is, how long they've actually had it, was there something traumatic that actually caused it. And it's not an exact science, unfortunately. You really have to sort of get a sense. Different athletes will react different ways to different things. From a coaching standpoint, again, if you are coaching youth athletes or high school or even college athletes, but more with the youth and high school, if you think that it is something a little more serious, if you don't have a trainer in your school, if you do, then have the trainer sort of triage and sort through things, because they deal with these things on an everyday basis. But it may come time for you to actually have a discussion with parents. If you're a youth coach or high school coach, I heavily emphasize this. Bring the parents into it immediately. Don't wait until it's too late. Let them know that you're concerned about a particular injury. They appreciate that, and it protects you at the same time. Rest, ice would be the simple prescription if you're unsure as to how to treat things. But bring the parents into it, and then last resort, if it's something really serious, you're seeing a doctor. But you need to have all those different levels so that you can be consulting with the athlete, consulting with the parent, and coming up with an appropriate plan to protect them as well as to protect yourself.
Yeah, so again, this is just touching on some of the stuff that Joe and Gary already said. Younger athletes have a harder time differentiating between that soreness and a mild injury. I think sometimes even adults that came to the sport later in life, a lot of times it's hard until you've had all the injuries to know, oh, it's muscle, oh, it's bone, oh, it's tendon, to be able to feel the difference and to know when it's okay to kind of I don't want to say push through, but that running is not going to make it worse versus no, if I do something today, it's going to make it worse. I think some of that just comes from experience and feeling your own body, but being able to think about the pain and identify where it is and kind of track it. And if it's moving around day to day, that's less concerning. So I know a lot of new athletes, everything hurts all the time. And so one day it's my left knee and one day it's my right knee and it's part of just getting in shape, because getting in shape is terrible and no one enjoys it and it's a process. So I think being able to just talk through that with an athlete is helpful. I think sometimes that's more the mental side of running, that you really have to just explain and kind of be there with the athlete as they're going through it. But if it's staying in one central place for multiple runs, multiple days at a time, it's very clearly something's aggravated in that one spot. That's more concerning. Sometimes easy runs help. So I think the initial response, especially from younger athletes, is if I'm hurting, I shouldn't run today. But sometimes running will kind of work out some kinks and flush out some stuff. And I'm not saying if you're sore and not feeling good, go out and do a hard workout, but doing a nice, slow, easy recovery paced run can sometimes be helpful and make you feel better afterwards. But that only works in certain situations. So being able to communicate, I think asking the right questions to an athlete, and as an athlete, being able to explain how you're feeling, not just I hurt, but being able to use descriptive words to explain what is hurting, where, and how can really help coaches and then medical professionals be able to diagnose what's going on and do that triage part, because no matter how good a doctor or coach is, you're not inside the athlete's body and you're not feeling what they're feeling. So trying to ask questions to get more description, I think, is helpful. And then as an athlete, to be able to self-advocate and kind of describe how you're feeling. Yeah, so Sharp pain is bad, it stays in the same spot, bad. Contrast baths can be helpful. There's more studies. Stacy Sims has done a bunch of research, and she's shown that women in particular respond much better to contrast baths. So after a workout, contrast baths, for those of you that aren't familiar, is just going from like a hot bath to a cold bath to icing, like back and forth. Trouble walking normally, pain for more than week. Okay, so basically, if you are changing your gait, if you are having a hard time walking or running, that's a sign. That's like a big red flag that you should probably go see a doctor. There's no reason to run. I've heard athletes say, well, I was able to run on my toes, so I just ran on my toes the whole time. If you have to change how you're running, it's not a good idea, and that's a very clear, definitive, oh, you shouldn't run that day.
Right, good point. All right, navigating injury recovery. We're rehashing a lot of stuff here, but I think it's important. I think we're all, trying to make a point. Establish your plan of care. Find out, get your diagnosis, get a guideline or a timeline of like what is my plan here going forward? What do I need to do? How often do I need therapy if I need it? How long do I need to rest? And what's the rehab program going to be? And do this with a medical professional so that you're really set up and you've got you're taking the right path to getting better. And then at the end of that, first of all, you'll have someone going down the path with you. So it's someone who's when you have questions about, should I change this up or should I be feeling this? You'll get the right guidance from that. And then at the end of that path, you should have, the expected outcome, and that you should be able to start going back to training. And then establish that safe alternative training strategies. And like coaches have said, light activity is going to increase blood flow. It's going to help remodeling. It's going to facilitate tissue healing, where you get to repair and then the remodel. And that's a big part of getting better, is allowing the tissue to kind of come together. There's certain stages of inflammation, repair, and remodel. And for different tissues, it's different time frame. For a tendon strain, it's going to be different than a stress fracture. But when you have that outline and in your mind, okay, I need to give this 4 to 6 weeks for that stress response, but I can go in the pool, I can bike safely, I can lift, I can do core workouts, I can do a lot of stuff to keep myself fit, and that's important. Just a little thing to think about too. I know that it's important. The coaches understand this, and I'm sure athletes do as well. But sometimes your heart and your head can get ahead of where the tissue is. Like you can handle a harder workout, and your heart is in great shape because you've done the cross training. But that tissue is kind of relatively new, that healed bone or soft tissue. And that needs to get up to speed with the rest of what you're capable of. So don't let the heart capacity or the mental toughness you have get ahead of the tissue. That can get you into a little trouble and get re-injured. So that's a good thing to keep your eye on. So again, I guess the same things. It's just like this is hitting home, but sleep. And coach has made a great point. I said that Dan Lieberman said you can get by with 5 to 6. It seems like that's what humans can all they need. But I think we know that with running or with any type of track and field or activity, you're going to need more. You're going to be tired, particularly in my situation where we have college athletes, and they're doing academic work. They have a social life, and then they're trying to train and they're trying to compete at a very high level. You've got to get that sleep, and that's where you're going to get the healing. In nutrition, of course, eat well, fuel, water, proteins have been advocated wisely, the products to prevent the muscle breakdown, There's good suggestions there. I would also say that just as a concept, think of the fuel that you're adding, and you're adding like fertilizer. You're just trying to, the blood that perfuses through your muscles and tissue, the more that you can have a quality to that, so that you're adding all your, the calcium you need and all the building blocks there, and that just keeps perfusing through that healing tissue, you're going to get a better end result. You're going to be healthier. So, that plate that Amanda identified earlier, that's power, and that's you can access that, and if you're consistent with it, you'll do better. The psychology, and I saw that USATF is going to do a seminar on this. I think that's a great idea. More and more we're having athletes. I think that's a great idea. What they're going through, we're having the psych athletes share part of our team. We have the teams that go through with the psych, and we know that it's important to talk about things and to get that with us. As Coach alluded to, the mental stress has to be accounted for so that the physical stress isn't overtaxed by that, and it will make a difference. So, speak to somebody, talk to somebody. It changes your life. You get hurt, and now you may be with the team, but you're not actively with the team. You kind of may feel separated, and that's going to be, that's a big part of the social. And if you're not there, it's a challenge. So it's something that a lot of injured people go through, and so definitely talk to somebody and get that kind of professional guidance. All right, what I like to talk about, tendinopathy. What happens, the areas are sore and stiff, and as Coach alluded to, sometimes it goes away with activity, and that's a good thing. And what does it feel like? So is it just stiffness, or is it discomfort? There are some things that there's something called tenosynovitis, that there's a crepitus in the tendon. There's kind of a crunchy feeling that's there. The tissue area may be warm, it may be inflamed and tender. And so I look at things, I call something called tissue bias. And we've alluded to that in several examples already. But, as you do these activities, particularly say we go from cross country to track, the repeated act of any of our activities, specifically done over and over again, causes what I call a soft tissue contracture. And it can be a joint contracture too. There can be a limitation on the extensibility of the tissue. So that just like you build up a callus on your foot from repeated load, you can get a callus or a stiffness built up into the muscles and the joints from repeated loads over and over again. Mobility exercises and stretching and slow, easy activities tend to comb these out a bit for you. But they can, if unaddressed or unidentified, that can be the cause of your injury. When tissues get overloaded, they're going to lack the load tolerance. They're going to break down, and that's a stress or a strain. Typical rehab, I'm an orthopedic manual physical therapist. Definitely, I feel that my manual interventions can help speed up or create an environment for healing to take place. So try to manually or through the prescription of exercise, give an athlete something where they can elongate that tissue contracture, unload the tendon, and therefore take the stress off the tendon and allow the pain to go away or the healing to take place. So unloading. And then Coach also talked about the eccentric exercises, and that you can use those to help remodel the tissue. Eccentrics have a higher strain rate than concentrics, and high-speed eccentrics even more. But we use, there's another popular application of load is called heavy slow resistance. And that's another application to help remodel tendons and tendon problems. Prevention strategies, like I said, it can be massage, which I go to periodically because of the manual work I do. I need to be combed out. Pre and post mobility routines are excellent. Pre to warm up the tissue, post activity to kind of try to maintain some of the extensibility that you want in the tissue. Extensibility meaning it can stretch out and not be overstrained and come back to its resting position. Specific load training to allow for adaptation is going to be key. And just another one example of these soft tissue contractions, this tissue bias that we get into, is when you're fit, you're on the cross-country team, you're used to doing your really cardio. They say, hey, would you jump in and help us on our team Frisbee activity? And now, like Coach alluded to, she said, you got to have that lateral quickness. Well, if you go in with a straight line bias, and all of a sudden you try to go out to the side, left or right, there you get your groin strain or something because you've gone outside that tissue bubble. So the more mobility you can impart to your tissue and your joints, you're going to have less chance for injury. But always think about that. What's your bias? What is your thing you've done over and over again? Like crew people, they row on one side for 4 years. They build in a twist. So we try to run opposite on the track. So you do some of your workout one way, you go the other way to cool down, maybe to unwind and stuff like that. So let's see here, what's next? Ligament sprains are going to be more traumatic usually. You turn or you twist your ankle on the track or maybe in cross. It's a sharp pain. It's going to swell up probably. It's going to cause like you to be, as coach said, you're going to alter your gait. You're going to alter your load capacity to stand on or to walk over that ankle or knee or whatever it is. It could be a hip as well. Common causes are usually it's unexpected, like you just didn't know, like you maybe step in a pothole. That can be something that just causes that. And sometimes you can get a little avulsion with these too. So it's good to get ligament sprains checked out by somebody, whether it's a doc or if your parents take a look at it and they can take you to someone to see and get that identified and an accurate diagnosis. Again, you're going to try to reduce pain and swelling. That's the primary thing. And that can be ice, although the literature in the last few years is moving away from ice. There's a nice acronym at the very end of the presentation, peace and love, and that's the new thing we're kind of going by. Gradual loading, and my niece actually just sprained her ankle, and I had to take a look at that. And just in the 15 minutes to get her to walk, comfortably, and that gait training is huge because then you're not compensating and with a limp, which is then going to lead to maybe tightness in your back or knee pain because you were trying to unload the ankle or something like that. So gait training and walking as normal as possible, even if it's very slow. And then part of that might also involve bracing or some type of a wrap or something to help the stability. Ligaments are stabilizing two bones or more together, and so that insufficiency in the ligament is going to lead to you need stability. So that can be imparted by an external device such as a brace or a wrap. And then again, going back, it's nice that we overlap here, but the proprioception activities can give you a better response time so that when you are doing cross and you hit a root, because you have been doing some off balance stuff, you can react, and that does build up. Once you train those neural pathways over and over again, they'll respond faster for you. Think of an ice hockey goalie or someone who takes shots. You need to build that response. You see people doing it with tennis balls over and over again, trying to catch things. So build in that proprioception and your capacity to respond versus wearing a lot of extra braces and pads on your elbows and wrists so when you fall, you don't hurt yourself. But that's kind of a joke. We're going to go into common muscle injury strain. It's usually at the a muscle pull from sprinting could usually at the myotendon junction. So if we were to look up the anatomy, it's usually the distal myotendon junction where you get that strain. And again, it can be, the muscle itself can be strained, but it's usually at the muscle tendon junction. And it might feel like a cramp initially because the muscle is going to contract to try to stabilize that area that's getting pulled apart. And the cramp itself can be a sharp pain and can be debilitating. Usually you see it in sprinters. I think that it's usually almost like a deceleration. Sometimes on the bank track too, coming off of a bank track, you might get a hamstring strain because they're coming off that and it's trying to, it's trying to coordinate that landing, and that's where you'll have it. And again, if your entire muscle tendon length is kind of compromised because you have a contracture in there and the tissue is already pre-shortened, you're not going to have that same extensibility and capacity to go out and, and get that full range of motion. Rehab, again, rest, ice or heat, rehab and therapeutic exercises, manual therapy, prevention strategies. Again, you're going to dose in the loading. I thought Coach made a very nice point about that, about, not increasing one variable, not increasing more than one variable at a time, where you go from you're doing like 2 workouts or something like that. So you really want to think about that and, not move up too fast. And then you can employ the massage if you have it. But there are a lot of new devices out there. And when we were talking technology earlier, the therapy guns with it's a self massager, the price on those are coming down. The old roller stick and the foam rollers and things like that you can apply to yourself and try to maintain some tissue mobility or work on some areas of contracture. People use, call them like a knot in there, but they are there, they're tender. And if you work those out, you can kind of get that mobility and extensibility back. All right, hip, common hip injury, muscle strain, joint irritation. So if you're, again, going back to one of our speakers here, the hip mobility and how important it is to have hip strength. Your external rotators, your glutes are an external rotator and an extensor. But when you land running, that external rotator is working eccentrically to control the amount of internal rotation as you're landing. And that's where the high strain rate comes in from the high speed eccentric. So that's where you can get the hip, glute medius and those other external rotators are working to kind of dampen and comfortably land your foot on the ground, and they have to adjust for that. So you can also get within the joint, you can get joint irritation. You can get a little scuffing, or you might have a little bit of a labral irritation, but you can get that, and that's going to feel a little bit different. The muscle strain is going to be more external. The joint irritation in the hips probably going to be when you flex your hip, or long duration sitting might be something that really provokes and irritates that. We talked about overload. I like the concept that came up about not giving yourself enough rest. That was good. A mobility deficit. So we talked about doing the hurdle walkovers and things like that to try to identify if there's a deficit there. And then you can go ahead and either get some manual therapy, or you can get some therapeutic exercises that will help restore that. And you can you can roll things out to maintain that. And then, like I said, sometimes in the hip, there's a labral change, but you can't always, there's another level of diagnosis there that sometimes you have to, if we do all of the people on this presentation tonight, if we MRI all of our hips, we may have some labral changes, but can we incriminate that labral change as the cause of the person's hip pain and dysfunction? And that takes, another level. It might be a specialist in that area to do that. And sometimes it might be a diagnostic issue where you may actually go ahead and get a cortisone injection. And if that makes a significant change, which it should, then you then can incriminate that, and then you can train, you can change some of your training to keep you away from overloading that hip. Like I said, it's usually flexion, internal rotation that compromises that. Rehab is going to be manual therapy, Therex mobility activities, and specifically, like was mentioned, for the hip, it's going to be clams and a lot of the things that recruit those external rotators. And sometimes the clamshell, just to get a little specific here, you can have somebody help you if you do it eccentrically. So it's almost like one of those windpipes or something, but you can gently close down so they have to resist you eccentrically. You can do that with the fire hydrants, with the TheraBand, different things like that. And if you feel, you can go on YouTube and try to find, again, a reputable site that demonstrates some of these things. But monster walks with the TheraBand, those are all great things to do to recruit those muscles. And by doing the monster walks, you're doing proprioception and you're specifically addressing the muscles that you want to get better. Strategies for the hip adaptation, or strategies for hip would be adaptation. Yes, go into things slowly and carefully, and then monitor and dose your load changes, and try to avoid the the specific mobility that is kind of causing this. And if not, you have to get that addressed and try to get that out of there, get that mobility back. What's next? Knee, the common thing is usually this patella tendinopathy. IT band may be more in distance runners, but also on people on the track. And then meniscal changes are particular to the knee. But patella tendinopathy has been definitely one of the more complex, challenging rehabs that we've had. There are a lot of people out there. There's a woman from Australia, I'm blanking on her name, but she's the best in the business at it. I'll come up with it. But it's going to be eccentric or heavy, slow resistance is going to be the therapy for it. It can be forceful loading from jumping, particularly someone who has like a long jump. That a lot of the stress and strain on these tendons, if it comes early enough, it doesn't change as you get older. You're kind of left with this residual stiffness in a tendon that's not as extensible, and it will break down and give you trouble. Downhill running is definitely going to be another load where the eccentric component of the quad is trying to gradually let you down, gradually bring you down, but it's going to cause a lot of stiffness in that area and overload the tendon. But you can, as far as, the long, there's something called, we used to call it a theater sign. So if you're sitting with your knee bent and it starts to bother you and you can't do that and you need to straighten your knee out, that's going to be part of it. I don't often see any type of crepitus in knee tendinopathy, but again, it might be warm, tender. There may be a palpable thickening versus the opposite side. The IT band, Rich Willie made a good point about this on one of his podcasts for Montana Running Lab. You don't want to compress it with your foam roller. It's really a compression injury. The way the biomechanics they studied it. And while I think of it, you want to roll the quad and probably the glute a little bit. The glute and the glute fascia blend into that IT band and the lateral quad. And when you do that, I wish I could demonstrate, but when you do the foam roller for the quad, try to do it. You're going to be face down with the roller underneath your quad, of course, but bend your knee as you're doing it. So it's not just all straight. So you're actually applying that flexion as you're rolling, which can mimic or reproduce the kind of flexion you're going to get when you're running.
Well, it shouldn't be much longer.
Yeah, that was a really good study that came out. It's made a big difference. He also, to jump down a little bit to rehab for that IT band, you want to run on a treadmill on a little bit of an incline, and that kind of unloads the IT band. And we've had pretty good success with that with some of my distance runners at Harvard. So that's been that was a key article to find. All right, we talked about terrain changes and how to be careful there. Rehab for tendinopathy, there's the heavy, slow resistance we were talking about. And I had actually, there was someone who came in, one of my better throwers one time, complaining of this tendinopathy. And I just read this article and I said, he said, it's bothering me squatting. And I said, well, the article I just said, so you increase the weight, and it sounds contraindicated, but it did help. And usually we try to go single leg with that. And, you know, it's lesser weight than he would have been squatting, but, you know, this heavy, slow resistance does remodel and get you going again. Meniscal injury will require an MRI usually, but your knee would be swollen. It might be difficult to get full extension. You know, a good expert can quickly do a sweep test to see if that is an we call intra-articular swelling. But just think of like a door. If there's something and you can't quite close a door all the way, there's something jammed there. The meniscal injury, either mechanically because it's flipped over or because of the swelling, that space occupying lesion will inhibit your capacity to fully extend, or if you do, it'll hurt. So you'll kind of drop down into like a 20 degrees of flexion, 20 to 30 degrees. And that's kind of a key thing. And you got to watch out for buckling and giving way with meniscal injury. You don't want to be kind of going down the stairs unprotected and have that give way on you. So that usually though comes from, you know, a trauma. It can come from a thrower, could get it. Someone who spins in the circle could break that down and then get a little bit of fissuring there, and then that swelling would come about. Prevention strategies, you know, gradual loading is good for the IT band and patella tendinopathy. It's not going to change our meniscal outcomes, but yeah, that'll be good. And I look forward to getting questions on this because it would be fun to answer questions here. Yeah, we're covering everything here, foot and ankle. We talked about metatarsal stress response, so that may be somewhat specific to runners, but again, it's usually someone, they think maybe I tied my shoe too tight, but I think someone made a good point, it's point tender, specifically point tender. That could be a sign of the stress. We also do something called a hop test, and that's a nice clearing test for a lot of stress injuries. If you can't hop comfortably on the involved side versus the uninvolved, if that's compromised, it's usually a sign that there's a stress response there. So usually it's I would say overtraining, overloading. Typical rehab, graduated return, you're going to be in a boot for a while, most likely, to allow the bone to kind of knit up again and get back to get that tissue sufficiency it needs to tolerate load. And then you be in the pool. You can do pool running with a metatarsal stress response. That's safe. There are other bones in there, like the cuboid and the navicular, that can be challenging, and those can break down as well. But again, I think that covers that. We put these new slides in here for our throwers. When we do think of our cross country, of course, we're not going to have throwers, but in track and field, we have upper extremity problems. And one would be a rotator cuff strain. If you're a javelin thrower or even any type of thrower, you could get that. But particularly for javelin, you're going to get medial elbow ligament sprains, UCLs. Just to go off a little bit here, it's interesting how in following a lot of the sports I do, I've noticed that baseball rotator cuff injuries have gone down, but medial elbow ligament and Tommy John surgeries have gone up. I don't have an answer for that, but it's just as someone who's kind of been around for a long time, it seems that rotator cuff was the big problem before, and now it's UCL injuries. But that's going to hurt a lot. That's going to be pretty tender. And you're gonna, again, it's gonna be compromised throwing. It may come from one big throw that you've done out there, whereas the rotator cuff strains, I think, are more a gradual breakdown and insufficiency. Again, rotator cuff is an external rotator, like we talked about our hip muscles, like the gluteal. So when you get the rotator cuff strain, it's because those posterior cuff muscles are eccentrically contracting, they're lengthening. As you go to throw, they're kind of controlling the throw. They have to, any type of controlling motion is usually an eccentric. Higher strain, particularly in throwing, it's going to be a fast eccentric. It's going to be high strain. It's going to cause some breakdown of that tissue. Like we said, usually myotendon junction. It can be at the tendoperiosteial site as well, but that's where you're going to see it. The increased torque, the elbow varus torques to resist the external valgus motion in the javelin thrower, and it just pulls away. It just breaks that down. The shoulder can be doesn't always need to have doctor take a look at it, but a UCL sprain is definitely going to require. You can identify it. A good clinician will pick it up for you, but you're going to go get a doc, or you're going to get a doc, MD ortho eval on that and get some imaging. Prevention strategies is great technique. The kinetic chain and the transfer of loads going up. We've had a kid from Czechoslovakia a long time ago, and he was much smaller than these other javelin throwers, but his technique was so good that he was our best thrower. And so you really have to look at technique and make sure that when you're doing a throwing activity, that you're allowing that transfer of power to come up smoothly and not trying to make it all up on your shoulder or your elbow. Back, billion-dollar industry. It can be sprains, strains, and I put in there discogenic changes. This could be a 2-hour talk in and of itself, but sprain, strain are going to be more sudden. You might feel like, oh, I did something to my back. Discogenic is going to have a different presentation. It might be somewhat a neurological contribution where you're getting irritation of the nerve root. And just a little thing to remember, muscles that are irritated, the nerves that are irritate the muscles they innervate. So if that L5 or something is irritated, it's going to irritate those muscles that L5 innervates. So just a little bit of a nice progression there. But it's usually the back is high loads. Maybe someone was squatting or doing, a certain activity in the weight room, and that causes a little bit, they lose it a little bit, and then there's a high load on there with a sudden motion, and that causes the strain, the sprain, and the strains come about from trying to resist that motion. Again, you're going to try to, reduce pain, restore motion, and then restore load tolerance. There are a lot of different exercises shown on the right that do that and recruit those muscles, those little extensor muscles, the power steering of the spine, and then the big paraspinals and such. Trunk mobility is good. Definitely going into this, we call it back hygiene, just like the hip mobility exercises you want. If you're going to be a thrower, you need to make sure you have good thoracic mobility in rotation. Lumbar is more of a flexion extension component, but you try to keep your hips loose too. The more mobile the hips are, that unloads the back. But really, it's think hips mobile, lumbar stable, thoracic mobile. There's a little Mike Boyle in there for you. So that's where I'd go with that. And again, if we need to get more specific answers on our question and answer, I'm glad to do that. Building back better. That sounds familiar. Yes, to make sure that your transition goes seamlessly, getting in touch with a professional and from your coach, making sure that you're on board with, who's going to get you there, and that you, again, plan of care, and then reintroduction to the activities, the specific activity that you're going to do, And then to also have a capacity to go outside of that, that keeps you healthier. I don't know if the coaches want to jump in here at all. Amanda?
Yeah, I think this slide is just a very kind of basic way of summarizing a super important point, which is that when something does go wrong, it's obviously a disappointment. It can be very frustrating. But I think the key takeaway here is just make sure you let someone know and get that professional guidance. So that can be hearing your coach's perspective. And if it's a little bit more serious, if it's been more painful, lasting longer, that's when you might want to call upon some of these other resources too. But just a big step in getting back is knowing what your resources are and using them.
Great.
I want to emphasize, Gary, having both a physical rehab and a mental health plan is really essential, as you alluded to earlier. We need to understand that athletics are like a drug. And when you take the sport away from an athlete, regardless of age, they go through withdrawal, they go through a sense of depression.
Really tough.
And it has to be factored into the plan itself. We need to also make sure that the athletes take ownership to the plan. There's got to be as specific a plan as possible, depending on the amount of time that the rehab's going to take, which totally depends on the severity of the injury.
Right.
The more specific the plan can be in getting the athlete generally involved in taking ownership for the plan and for making sure that it happens on a day-to-day basis is critical, because one of the main things with athletes and people just growing up, teenagers growing up, is that sense of control and that sense of structure. And especially in today's setup with COVID, where that control's been taken away, the structure's been taken away. Now, if they're suffering an athletic injury, that compounds it even more. We need to make sure that we're factoring that into the plan more than we would have 2 or 3 years ago. We also need to understand that cause and effect of the injury. All too often, athletes focus more on the affected area. And oftentimes, the affected area is caused because they had ill-aligned hips, or their glutes were really weak, or the hips, especially now sitting in a desk as long as they have tight, or they have a foot issue. The rehab plan is a great time for them to work on those other areas that may have caused the injury or impacted the injury.
Or contributed,
Bringing in a dietitian. This is a great time to do that, to have your nutrition plan evaluated and assessed. What you want to do as part of the plan is not just heal the injury. You want to make it better when you come back by doing things that will improve your performance when you come back. That means taking in the total plan itself. And then also understanding that once an injury is healed, and this is critical with kids, they don't understand this. It's not that they don't understand it. They're in such a rush and want to get back out there. They want to get the injury healed well enough so they can go out and perform. But they don't understand that just because you can walk without pain doesn't mean that the affected area is actually strong enough to return to action. That they have to continue that plan well into their actual process. So I
don't get re-injured.
That whole plan and get them to understand it and take ownership for it as they progress through it.
I definitely think adults are guilty of doing that too, because if you've been running for long enough, I guarantee you've had a few injuries under your belt, and you've had to do that whole return to competing process of all your rehab exercises from your PT or your OT or whatever, and you do them religiously, and then you can start running again. And if you really did all the exercises you were supposed to do afterwards for all the injuries you've had in your whole life, that would take all day. So being able to go through that list and with a coach or a doctor or with other running friends and be able to say, these are the areas that I'm really weak in, and these are the things I should focus on and prioritize, but figure out a way to fit them into your life, even if it's on a lesser scale than when you were really trying to get back, so that they don't happen again.
And if I could add a bit more to that, all the things that we've already discussed, that Maggie had discussed for exercises to do, and that you would alluded to, Gary. With our program, we do the best we can to try to do these rehab exercises as part of our normal training.
Right.
So that now if they do get injured, they understand what the rehab is. They know how to do it a little bit better, and they're more comfortable. So we don't wait to get injured. We try to do the preventive things beforehand as well.
Right. Prehab.
Right. And that's my slide. I just covered that.
Yeah, you're good.
Yeah, I feel like I covered this too. Oh, fueling. Fueling, I think, is a big thing. There was a quote, one of you guys said that, what was it? It was, it's not under training, it's under recovering.
Yeah.
I like to say sometimes it's not overtraining, it's under fueling. And it goes hand in hand, because if you want to increase that training load and your stressors, you got to be compensating on the other end of it. So the recovery part, the more sleep, but also got to eat more. And I think high school athletes and college athletes sometimes have a hard time with that. I think female athletes have a harder time with that, and talking about body image and everything. And I think one key takeaway I've found from having different dietitians and registered nutritionists come and talk to my different teams was thinking about fueling for your running as separate from your fueling for your day. Because
that's great.
Yeah, you need to eat whatever food, whether you're a 3 meals a day person or a 6 little one or whatever works for you, but you need to do that regularly to function as a human being in the world. And then if you are a high performing athlete, thinking about fueling for that completely separately. So having your pre-workout meal and your post-workout for recovery or whatever, but it's an addition to, not a instead of.
Yeah, and think of it as two like motors. Like one, you put the fuel in, that's the motor in the front of the car that's getting it going. But then there's another, the body's looking for that fuel source to rebuild everything. And the going forward motor is going to demand it and take it, and you've got to have something there for the rebuild later. So
yeah,
they'll compete for the fuel.
Definitely. And then the whole strength training, we've all said it. I think, again, I'm going to reference Stacy Sims for the women out there, or the coaches that coach female athletes. I would definitely look into some of her research and her book, Roar. But a lot of her studies have found that lifting heavy, especially for women, promotes that bone growth and increasing bone density, which is a whole nother slew of injuries that you can have. Right.
So this next slide involves some perspectives from arguably the most successful javelin thrower in U.S. history, Kara Winger. So she represented the U.S. on 4 Olympic teams. Most notably was the 2021 U.S. Olympic flag bearer. So we've got a picture in the lower right of her closing ceremony with that flag, and is the former American record holder. So I think based on her accomplishments, a lot of people might assume that she had this very smooth path, always performing well, always successful. And she actually had some very serious injuries that she had to work to overcome. So toward the end of college, she had a stress fracture in her back. In 2012, which was her second Olympics, she actually tore her ACL at the US Olympic trials, through at the Olympics with the torn ligaments. Right as she was getting back to her top form in 2015, her rotator cuff tear on her non-throwing side. And then in 2020, toward the end of the year, right as the build-up to 2021 Olympics was getting started, she retore that ACL. So she obviously had to overcome a lot of adversity, and I think she has some great tips on both the physical and mental side of injuries. I think one of her biggest tips was to enjoy everything else in your life. So no matter how good you are at your sport, there's always a lot of other things that you're doing. You're always a lot more than just an athlete. So enjoy all of those other things, and surround yourself with people who can help you recover, whether that means medical professionals who can diagnose the problem and give you a path to getting better, or people who are providing more emotional support. Surround yourself with those people. It's important to be optimistic, celebrate the small steps, even if you're not quite at peak form again yet. Just remembering, until you can do everything 100%, you're not totally healthy yet and not able to do everything. And then even when you do have that full recovery, keep those PT exercises up, because that's a lot of what can help prevent that same challenge from occurring again. And put this one at the end because I think it's a great thought to end on, but don't let injuries deter you from pursuing your athletic goals. So a lot of people with just one of Kara's injuries may have said, you know what, I don't want to pursue this. I don't know if it's for me. But I think she really shows everyone, you know, even if you had this challenge with an injury, if you take the steps day by day to get back, you can be right back at the level you were at before, and enjoy it and really appreciate your sport in a new way. So that covers all of our slides. We do have some time for questions. I want to be mindful of our speakers' time. I know there's questions in the chat, and be happy to take any other questions as well. So just going through the chat here. We have a question. I think Gary's probably the best suited for this one, but when would you use heat or ice to help recover from an injury?
Ice initially is still a wise move just because it's going to take away some of the pain. But after 24 to 48 hours, I would go heat. I don't have the specific article, but like I said, in the and out there, the literature is kind of about 5 to 8 years ago, I'd say they've really gone away from icing, you know, too much, and found that it really doesn't do as much as we hoped it would. But in an acute case, definitely brings down the pain and helps to control swelling. And, you know, really it's, think of it as compression. You know, a cut on your finger, you wouldn't just ice it, but about compression, you'd want to, you know, that would stop it. So it's really about, you know, compression early on, and then after that, you know, allowing the normal inflammatory process to help, you know, guide the healing. So I would say it's okay to use heat a little sooner than we would have, you know, a long time ago.
And when you say manual rehab, I know you had mentioned that a few times earlier in the presentation, or stretching, does rolling work too? So say you were on your own or didn't have physical therapist there,
Right.
Could rolling kind of serve that purpose?
Yes, I think it can. It may not be as specific as human hands in identifying, particularly a clinician with skills may be able to identify certain areas to work on and do things, more specific tasks. But generally, yes, it's good. It can, you can find those spots yourself, not always, you know, with just a foam roller. You may need the roller stick. You may use a lacrosse ball. There are different devices now being sold, but yes, you can do a lot of self-care and self-management without, without an external, expert.
All right, and then I can take the next question quickly. But we talked about that plate method, and for someone who's very active, a lot of times you want half the plate about with carbs, and then veggies and protein another half, and then you've also got your fruit. And this person's just asking about calcium. So I know we didn't go that in depth with the plate method and kind of how to organize your plate, but there it can be helpful, and some people don't like milk, allergic to it, etc. To also have a glass of milk. So there's different kind of iterations of the plate method, but some of them do recommend a glass of milk or a glass of water. So that can be a source of calcium. A lot of your best sources of calcium are going to be those dairy products. So, and a lot of those are common at breakfast. So that would be a place to get a serving. Again, milk at those meals would be a way to get a serving. A lot of times grain products can get fortified with calcium. But in general, if you're getting a couple of those servings a day, you should be set in calcium. There's also a lot of different vitamin products that in and of themselves will give you the calcium that you need for the day.
I know that last time Maggie and I talked a little bit, and Joe may have mentioned it as well, but I said something about chocolate milk after, is a big push now. It's been around forever. I think it was done at Ball State maybe 20 years ago for recovery. But Maggie, I think you mentioned something else that was almost like better, if you're still around.
Yeah, so I remember talking about chocolate milk because the running camp, it's a high school running camp I coach at in the summer, they set a record for like the quickest they went through an entire like giant vat of chocolate milk. But for me personally, I have chocolate almond milk.
There you go. But there was like better protein or different, it could be different protein choices too. You had a good point there. Yeah.
Yeah, and I think one benefit of that chocolate milk is it has that protein source, and then it also has carbohydrate, and especially if you're a distance runner and your exercise is longer in duration, you'll need more carbohydrate to promote recovery. So it helps with replenishment of that stored carbohydrate, and then also the simpler sugars in it just help that protein to go into cells more quickly. So that's why I think chocolate milk comes up as a potential post-workout snack. We have an interesting question in the chat box next, but it is, have you ever sent an athlete to a competition before they were truly 100%, thinking about big meets, conference championships, etc.?
For the coaches or?
Yeah, I think this one sounded like it was whoever asked it can pipe up too, but I think love to hear the coaches' perspectives. Then Gary, if you have any
I think
thoughts.
as long as it's deemed safe. I mean, you may not be 100%, and you can, because other athletes in other sports may not play but as long as it's safe, you may not be 100%, but it's safe for you to compete. Yeah, I think there'd always be, it would have to be a safe exposure, and at least with high school and college and all of that, pros can make their own choice, but
I think a lot depends on the age of the athlete and what's
right.
If it's a senior athlete, whether it's in college or high school, you may take the risk, especially if this is their last hurrah. They're not going to go on and compete in college, and it's something they've worked for 4 years for, and you don't have any alternatives, then you may take that risk. A younger athlete, I personally would never take the risk if you have a freshman, sophomore who's still developing. Number one, just from an educational standpoint, you don't want to teach them that that's the appropriate action to take.
Good.
Yeah, I think I definitely have made different decisions for myself as an athlete versus someone I'm responsible for. Yeah.
Good.
Yeah, so it sounds like there are a lot of different factors you would consider, and age of the athlete is a really big one. So next question, do you periodize weight training? And I think at first glance, it's obviously each program is different, but I think that is absolutely something in a training program that would be changed with time, depending on a lot of different factors. Feel free to add anything else.
I would say yes, I do. It's the same as running. You don't want to introduce more than one stimulus at a time, and you don't want to increase the load too fast. And so, yes, incorporating that into a strength training program is just as important into your running program.
Right, and then it looks like we've got one more question, a little bit more nutrition focused. Going into gluten-free diet, does it have any running effects? So for someone who is gluten intolerant, that would going on a gluten-free diet would definitely help them, because it would enable a number of things physiologically to happen for them to use that food they put in their body more effectively. I think, if someone who's doesn't have that intolerance is going on a gluten-free diet, or if someone who does have that intolerance is going on a gluten-free diet, I think it's important to remember that carbohydrate has a lot of important roles for someone who's very active as the preferred fuel of exercising muscle. It promotes performance in a number of different ways, and it also, when you have enough of it, protein can do its job of building and repairing tissue. That being said, I think because gluten is a protein found in wheat, it is easier for someone on a gluten-free diet not to take in enough carbohydrate. So I think it's important to be aware of what the other carbohydrate sources are, and just be on the lookout. There's obviously more and more gluten-free products being developed. So just being on the lookout, if you're having bread or pasta, finding those gluten-free products. But I think if you make sure you have adequate carbohydrate intake, there shouldn't be an issue there. We just have to be aware of it. So that covers all of the questions in the chat. Thank you again for joining us tonight. This slide here just goes through a acronym Gary brought up earlier, peace and love. These are just things in general to keep in mind. Recovering from an injury. An article on just rethinking mileage is an important metric, or rethinking of it is this all-encompassing metric for measuring your training. And then we also wanted to let you know about our next webinar. This is going to be in about a month, Thursday, February 17th, and it's on learning how to maximize your mental approach to training and competing. And our speaker is incredibly accomplished athlete, having raced in the Olympics, and she also has a PhD in psychology. So I think she is one of the very best people to learn from about how to maximize your mental approach in whatever you're pursuing in sports. So we encourage you to mark your calendar, and we'll be sending out an email with more information.